pass those here and to help. This is a nostalgic piece of paper for me. If you would like health reform to go forward and you want Congress to take this step, get this done, get us that far down the road, it is important for you to call Congress and let them know that you want them to do that. And I'm going to tell you a little more. And out of respect, if there's anyone in here who doesn't or who has reservations, this is the time to let Congress know what you want. This is a democracy, and we are all to participate fully. That flyer is odd because I used it, I found it and I used it in July and August, and usually I have to have a new flyer all the time. But we're really back to July and August, the sense that the most important work is to let Congress know whether we want them to move forward, and I want them to move forward, and cross the finish line and get healthcare reform passed. And that is really the only message. And the window of opportunity is pretty much to influence whether they do nothing, they do very little, or they go ahead and get it all the way done, is between now and the State of the Union on Wednesday. The President is going to have to figure out what he's going to say about healthcare at the State of the Union. And both Speaker Pelosi and Senator Reid have indicated that they don't yet have agreement within their caucus to pass a bill. And the most important deficit is on the House side. The caucus, the Democratic caucus, which is the majority party, and we did in fact have a Louisiana Republican vote. The caucus that voted for health reform on the House side is no longer in agreement. Some of them have cold feet. Some of them are mad that it doesn't go far enough, that we don't have single payer, that we don't have a public option. And some of them are mad because they think it goes too far. So, but we did have 221 votes to pass a bill out of the House when it needed to happen in July, August, whenever it was. And so it could still happen if enough of us contract our congresspersons. So it's important to contact your congressperson and your senator, let them know what you want. And even if you think your congressperson is going to do the opposite of what you want, it's still important to contact them, because the main impetus that will determine what happens next is political will. And one of the major measures of political will is what are voters saying and doing. So, whether you feel passionately that it must happen or it must not happen, please exercise your right in this democracy to let Congress know what you want, and do it now. You could do it this weekend. They're in session. They're taking calls. Do it again on Monday. Do it again on Tuesday. This is all points bulletin for healthcare reform, or again, if you disagree. So that's the overview, which took more than 15 minutes. But now, and I do want to emphasize too, I'll take questions.